So now that we have the hazard for both patient 1 and patient 2, we can compare the two. Note that for both of them, they have their representations in terms of the baseline hazard. So this is saying the hazard for patient 1 is the baseline hazard times 1.79, and here the baseline hazard times 1.35. Now we know that the hazard is always greater than or equal to 0, which means this is always a positive number, and this is always a positive number. Because the factor on patient 1 is higher, this means that patient 1 always has at least as much risk as patient 2, if not higher at every time point. And so we can now compute the hazard for some new patient 3. So for this patient, we can compute their risk as lambda naught of t times x of 0.08 times whether they're a smoker, which is a no here, plus 0.01 times age, and their age is 50, which is going to come out to lambda naught t times x of 0.5, which is going to come out to our baseline times a factor of 1.65. So now that we've computed the hazard for all three patients, we can actually compare the risks between the patients. So here we see that the factor associated with 50-year-old smoker is high, followed by the 50-year-old non-smoker, followed by the 30-year-old non-smoker. So we can create a rank that says patient 1 has a higher risk than patient 2, who has a higher risk than patient 3.